Welcome to the She Found Motherhood podcast. This week is Canadian Infertility Awareness Week, and so we've decided to do our first of a three-part series on infertility. Dr. Ginevra.Mills, who is an obstetrician gynecologist and specialist in reproductive endocrinology and infertility, joins us today to talk about fertility as we age. We have a really great conversation around the definitions of infertility, what are the chances of getting pregnant as we go through our lifespan, and why does infertility decrease as we age, both in men and in women? We'll get to that conversation right after this quick reminder.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Welcome to the She Found Motherhood podcast. Today we have a special guest, Dr. Ginevra.Mills, who is a obstetrician gynecologist with a specialty in reproductive endocrinology and infertility. We are lucky enough to have her just moved to Victoria and being one of the first reproductive endocrinologists at Olive Fertility, which has just opened up here in Victoria, which is very exciting. You also have 3 kiddos of your own, and you sound like you're quite the outdoor enthusiast, love some running. Tell us a little bit more about yourself.
Yeah, great. Thank you so much for inviting me to be on the podcast. You've done a great job of introducing me. I am quite a bit of an outdoor enthusiast, and I'm really excited to be in Victoria, and I'm enjoying this wonderful springtime, and I'm looking forward to getting into some trail running, which I haven't really done a lot of before. But in terms of me personally, yes, I do have 3 kids. They are 12, 10, and 6, and they're also really loving the Victoria lifestyle so far. I moved here recently from Montreal, where I did my fellowship training there. And before that, I was living in Edmonton, and that's where I did my obstetrics and gynecology training. And I also did my medical school in Saskatchewan. So I've been all over Western Canada and a little bit in Eastern Canada, but I'm really excited to make Victoria my hopefully last place that I move to.
We are very happy to have you here, so welcome.
Thank you.
So today we are talking about fertility as we age. So we know that the average age of people getting pregnant these days is getting a little bit older and wiser in our years as we're focusing on careers and finding the right partner, et cetera, et cetera. And so we thought this would be a great topic for our listeners to understand a little bit more about fertility and what infertility is defined as and how that changes as we age and what that might mean for us. So why don't we get started by just getting a definition of what actually infertility is? What's the actual definition that we should be working with?
So when we look at the definition of infertility, the true definition is failure to conceive after 12 months of intercourse without contraception. So this doesn't mean that you're trying to get pregnant for a year. This means if you are not taking a birth control pill or your partner is not using any type of barrier contraception like a condom, and you're having regular unprotected intercourse and you're not getting pregnant, then this could fall into the definition of infertility. So sometimes I see patients who have been trying to get pregnant actively for maybe 3 months and they're not getting pregnant, but they've been having unprotected sex and just waiting to see what's going to happen for maybe 6 months before that. So really they're at 9 months of trying. So it's really important that it's not just trying to get pregnant that counts as time to add to this window of infertility. If you've been having unprotected sex without birth control and without a barrier of contraception for 12 months, that categorizes the fertility.
I've already learned something today. I thought it was active trying for 12 months, not, as I say, not trying. So that's really interesting because oftentimes we have people in our office who've come in who've been not trying, as I like to say, for a
Yeah.
period of time. And then we go over the ovulation and the menstrual cycle and when the most fertile windows are and trying to get them doing ovulation testing with those strips and then actively timing their intercourse around when they should be ovulating. And we'll do that for 6 to 12 months, depending on their age, before I refer to a specialist. So that's really interesting. That changes my view of things. Thank you.
Oh, good. I'm glad that you're learning something right off the top here.
Right off the top. Okay, so what is the chance of getting pregnant per month in most people? And now we say that, but we are going to talk a little bit about aging and
Yeah.
reproduction later on. So obviously I'm assuming, again, who knows what I know anymore, that this changes as we age, the kind of expectation.
It certainly does change as we age. When we are looking at the chance of pregnancy per month, and this is just general, again, unprotected sex, not trying or trying. Either way, if you're having unprotected sex and you're around in your early to mid 20s, your chance, all comers and all population, of getting pregnant every month is only about 25%. So a lot of women or people, sorry, who are trying to conceive, they get all excited and they do the ovulation predictor kits and they time their sex and they feel like they're doing everything perfect. And even if you're doing everything, quote, perfectly, you still only have maximum 25% chance of getting pregnant that month.
So interesting, hey?
Yeah. Over the course of, let's say, 3 months, that 25% and then 25% and 25% comes up to about 60% after 3 months and about 75% after 6 months. And so, as you can see, it is still like rolling a dice. Like the chance before doesn't necessarily impact the chance in your new cycle, but cumulatively over time, by about 6 months, 75% of people, couples trying to conceive, have conceived. And after about a year, it's 85%. And so that's why a year is made the cutoff, because we know that the chance of getting pregnant every month is only about 25%. And we need to give your body time to get to that point before we do all of these other more stressful and invasive types of testing. This does change with age. And so at the age of 30, on average, your rate of pregnancy every month goes down to about 20% per month. By the age of 35, we're at about 15% per month. And by the age of 40, your chance of spontaneous pregnancy is only about 5% per month.
That's a huge change. It dramatically
Very.
decreases, which is, I think, why there's so much out there about really thinking about your family planning earlier as soon as you can in your life when you're stable and you have that kind of sense of what you want. Because as time goes, if we haven't thought about that and prepared for that, then the opportunity can sometimes slip by us. Luckily, we have people like yourself to help support us. But at the same time, that's not always a guarantee either. So it's one of those things to make sure that you have your thoughts about. And if you are thinking of delaying pregnancy quite significantly, which is totally fine, it's important to talk to your care provider about that and if there's anything that you should be thinking of around that. So that's really great information to know.
We also at Olive, and any fertility specialist will do this, but we will also see consults for people who are interested in getting information about where they're at in their fertility journey or family planning journey. And part of that, you might see it as like an egg, getting a consult for an egg freezing cycle, for example. But just because you come and talk to us about your fertility options or what it means to freeze your eggs or where you're at in terms of your fertility journey or family planning journey, just because you have that appointment with us doesn't mean that you have to do anything about it. So we're always really happy to see people when they're seeking out this information. I think it's we've done a disservice to many people by not talking about age related fertility decline in health class in school, for example, or even in early university years, or not that everybody goes to university, but just in our late teens, early 20s, talking about this age related fertility decline, because I do get a lot of people in my office in their mid 30s, and they said, I had no idea. I had no idea there was a difference between being 25 and 35 when I was trying to get pregnant.
Yeah, no, it's very true. And that's part of why Sarah and I started this platform is because there's a lot of misinformation, but there's a lot of information that we just don't talk about that we as healthcare providers probably know about, but we don't necessarily talk to our patients all the time about it. And so these types of conversations are really important for people to hear. So let's talk a little bit about why there's a change in fertility
Okay.
as we age or become more wise, as I like to say. Although I said that
Yes.
to my child the other day, and they're like, yeah, but are older people really more wise? And I was like, no, you're right. They're not necessarily more wise.
It sounds like your child and my child would get along very well. Of
They're both wise beyond their years.
course. So, why does our chance of pregnancy go down as we get older? This is a really important question. And it happens because women and people with ovaries are born with those ovaries, and all of the eggs that are ever going to be released in that lifetime are present in the ovary at the time of birth. And in fact, the maximum number of eggs is actually at what when you're about 20 weeks gestation. So when you're a 20-week fetus, that's when you have the most number of eggs. And from that point, they are dying off and they're accumulating mutations in the same way that every other cell in your body ages and accumulates mutations from just everyday living and get the eggs and in your ovaries are doing the same thing. And so they remain relatively stable until about that age of 32 to 35. But then they really, the quality of the egg starts to break down. So in the same way that the quality of any of your other cells where you notice that your skin isn't as firm as it used to be or whatever, the eggs are going through that change. And so when they when it comes time for it to be that egg's turn to ovulate, it just doesn't function as well. So in that might mean that it can't be fertilized as well, or it might mean that it fertilizes, but there's something wrong with the machinery of the egg that doesn't allow it to develop into an embryo to implant. It might mean that it implants, but then it stops developing. And the biggest thing that we see, especially as women get over the age of 35 and start having increased risk of miscarriage as well, has to do with the way the chromosomes separate. And the biggest thing is that the chromosomes in an egg are they're lined up and ready to go. And they're attached to these little strings and they get pulled apart when the egg gets fertilized. And those strings really start to break down. And so you get these chromosomes that don't separate properly. And then you end up with these eggs that don't have a normal number of chromosomes. And that leads to increased risk of miscarriage. Sometimes it can cause you to not be able to get pregnant. And sometimes it causes an increased risk of miscarriage. But it pretty much has everything to do with the fact that your eggs are getting older and there's really nothing we can do to change it.
Yeah, I was at this great conference years ago in Portland. If you've not been to Portland, I highly recommend it. And they were talking about how, like you said, we are born with all of the eggs that we have, and what our mothers, our birthing parent or pregnant parent,
Mhm.
ate during kind of implantation and during that time affects their grandchild, because that
Mhm.
whole like milieu that we were in is affected by the person who was feeding our eggs. So our mother. So it's just such
Yeah,
this interesting. Now, let's not all go on a guilt trip about not having perfect diet in pregnancy. That's not what I'm saying. I'm just saying the body is pretty cool and how we work is fascinating. And then the other piece of the story is as we age as people as well, like you said, all of our cells are changing throughout our body, and we're accumulating all of this time for medical issues to come up. So oftentimes, somebody who's 40 is more likely to have some medical issues than when they're 25, be that type 2 diabetes or a bit more obesity, perhaps, or hypertension, or a number of things. So that also plays a factor in kind of that fertility, I would assume. Probably not quite as big of a factor as the actual egg number and quality, but certainly it does play a factor in their pregnancies as well.
definitely. It certainly does. I like to tell patients that there's a process to getting pregnant, and then there's a process to staying pregnant and continuing to that pregnancy on to giving birth. And they're in the world of gynecology, they've been separated a little bit. And even though my training was in obstetrics and gynecology, and I was responsible for that whole range, I specialized into this getting people pregnant. And it is really important that we talk about all of those other medical conditions that happen to be present when we're trying to get pregnant. And sometimes they're important. Diabetes, for example, is one of them, and high blood pressure. And some of them are less important, but they all do really come into factor when we think about healthy pregnancy. because we're not just focused on getting pregnant. We're focused on having a baby. And so we do have to keep that in the back of our mind that getting pregnant is just the beginning.
Yeah, and I think that's great that you take that into consideration when counseling your patients, because unfortunately, sometimes we have people who are pregnant at the age of 45 with support to get pregnant who either haven't heard that because they didn't necessarily want to hear it or actually didn't hear that. And so then we're trying to guide them through a much higher risk pregnancy. So it's nice to hear that you have those conversations with your patients as well.
Is this pain I'm feeling in my pelvis normal? Should I do genetic testing for chromosomal differences in my baby? Is it safe to go to the dentist while I'm pregnant? Doctors and maternity specialists Sarah and Alicia are here to empower you with even more knowledge so you can have the best pregnancy, birth, and postpartum experience you can. Presenting the Pregnancy to Parenthood podcast, a new series of informative episodes geared week by week toward whatever trimester of pregnancy you're in. Tune in weekly, following along relevant topics as you move through pregnancy, or just binge listen and come back to the episodes you found most helpful. Access the full series for a full 2 years and listen to it on your own time. To learn more, go to www.shefoundhealth.ca or click the link below.
So we've talked a little bit about aging and egg quality and egg numbers in women or people with ovaries. What about those with sperm? How are men affected with age in terms of their reproductive capabilities?
This is a really great question, and it's been changing a lot. The answer has been changing a lot in recent years. It used to be the belief that as men got older, or people with sperm got older, it didn't matter how old they were when they wanted to father a pregnancy. And the opinion on that has been changing a lot recently. So initially, they were finding that in conception or in children born from sperm from older people, like over the age of 40, they were seeing increased numbers of spontaneous, what we call new autosomal dominant conditions. And so these aren't necessarily something that are going to hinder getting pregnant, for example, or increase your risk of miscarriage, but it causes, there's some changes in the way the DNA is exposed in the testicle or when it's stored that causes it to have these new mutations that lead to things like achondroplasia or dwarfism or Huntington's disease, which are all autosomal dominant mutations, meaning that you only need one abnormality to happen. And they seem to be happening with a higher propensity in people whose sperm or fathers, for lack of a better term at this point, were over the age of 40. There were some other things that came up, like really rare conditions that we call methylation disorders that we were seeing more frequently in men who were older when they fathered pregnancies. But recently, there was a new study that came out that said that there seems to be that when the male partner is over the age of 40, they have about a 25 to 40% reduction in their success of pregnancy than they did when they were under 30. We don't really know why that is. It used to be that they thought that the reason that sperm could transcend the age was because sperm is constantly being produced in the testicle all the time. But they're now beginning to think that perhaps the cells that make the sperm, which are related, like embryologically related to the cells in the ovary that help to nourish the eggs when they're sitting there, that those cells, they themselves are getting older. So they're just not working as well as they used to. So now that these sperm, you want to call them like a progenitor cell almost, that are producing these sperm regularly, the actual cells that make them are just not working as well. So that's the rationale behind why maybe the sperm is not functioning as well either to help get pregnant, or is just there's a little bit of these little genetic mistakes that are happening with increased frequency.
Awesome. So interesting. Yeah, because we're always taught and understand that sperm are just constantly being regenerated. So unlike ovaries, which have all of the eggs that they're ever going to have at 20 weeks of gestation, sperm is constantly being reproduced. So it is not as likely to have a kind of abnormality within that kind of cellular structure, within that DNA structure. But it sounds like maybe that information is changing. And again, learning something new.
Yeah.
That's so great. So I think one other thing that I wanted to chat about is as we are aging as people with ovaries, how can is there a way to tell how our ovaries are functioning? As we know, as we get closer to menopause, which the average age is 50, 51, in most menstruating people. Our cycles, for a few years before our cycles start getting more irregular, they start getting more heavy, et cetera, which leads us to believe that we're not actually ovulating on a regular basis. So is there a way, just through people checking in on themselves, how they can tell whether or not as they're aging, their ovulation is still occurring? Is there something that we can be guiding them around, or is there any
Yeah.
testing that we can do?
So the first sign that you're ovulating, as you alluded to, was having a regular period every month. And we consider a regular period anywhere between about 25 to 35 days. And so if it's within that range every month, regular ovulation or regular periods is 97% predictive of ovulating. So when we're having irregular bleeding outside of that time frame, that would be a sign that maybe you're not ovulating well. But most of the time, people who menstruate are having regular periods in that window. And you said, well, that's not helpful, especially when you're in that, maybe you're in that early 30 range and you're thinking, okay, I want to know how my fertility is. One of the very early signs that there's a potentially a decrease in the number of follicles that your ovary is recruiting every month. And this is a whole medical school level lecture. So I'm going to try to keep it as simple as possible. But when your ovaries are bringing up a selection of eggs that they want to potentially ovulate in a month, as your ovaries start to diminish in their number of eggs, they bring fewer and fewer, which means that those fewer follicles have to do the same amount of work that maybe a bigger group does in a younger woman or a younger person. So the result of that is they work harder and then they do their job faster, and your periods might start getting a little bit shorter, like your cycles. And so if when you were 24, 26, you had 28-day cycles all the time, and now you're 30 and now you've noticed that your cycles are always about 26 days or 25 days, then that is something, again, is something to look at over the long term. This is not something like last month my period was 28 days and this month my period was 26 days and now this is a disaster. Like, this is something that you're going to look over. And it's really easy now for people to do this because everybody's tracking their cycles on an app. And so you can have 3 or 4 or 5 years of your period history if you track it on an app. And that's pretty much the only thing I like about period tracking apps, is that people can see this long-term study. In terms of what you can do testing wise, there is one test that we look at. It's called an anti-Müllerian hormone, or AMH. It's not covered by MSP, so I don't recommend that everybody goes out and has their AMH tested. But what it does is it's a hormone that's produced by all of the follicles that are in your ovary. And when it's high, we say, okay, you have a high number of follicles. And when it's low, it says we have a low number of follicles. It doesn't predict current fertility potential. It doesn't predict future fertility potential. It doesn't even predict when you're going to go through menopause. But it's really helpful for us as specialists to say, if we were going to do any kind of treatment, how are your ovaries going to respond to that? And if you have a lower than expected number, then we might think, okay, we know if we're going to do treatment now, your ovaries aren't necessarily going to respond as well as somebody who has an average number. And maybe we need to talk about changing your family planning goals, or we need to talk about freezing eggs, or we need to talk about just knowing that information. So it's tough because it used to be this thing that we did to say, oh, you have a lot of eggs, that means you're going to last for a long time, or we do it say, oh, you're running out of eggs, you need to get on having kids. It doesn't really, we've come to see that it doesn't really work that way, because there's not just egg number, but there's also egg quality. And really, egg quality is what we're looking at when we talk about this age-related fertility decline, because it only takes one. And you could have a low ovarian reserve when you're 29, but have good, healthy eggs. It still only takes one good, healthy egg.
Awesome. We covered a lot today. Thank you. And we talked about what the actual definition of infertility means, and I learned a little bit something about that. We talked about how, as we age, the chance of getting pregnant per monthly cycle decreases. And we talked a little bit about why, in terms of our ovarian reserve, in terms of our quality of eggs, and in terms of our number of eggs. And we also talked a little bit about how aging in men, or how aging in people who produce sperm, can change over their lifetime as well. And then we learned a little bit of how we can keep an eye on our menstrual cycle to determine whether or not we're ovulating and if that's changing over our time. So thank you so much for joining us today. Where can people find you? Because I know you've got an Instagram and a website.
Yeah, so we have a website, is Olive Fertility Victoria. I think it's easier to just Google it, but Olive Fertility Locations Victoria. And we are just located, we're opening our current clinic on 911 Yates Street. So you can find us there, or you can find on our website, we have a referral form that your doctor can fill out for us. And I've just recently ventured into the world of professional Instagram, and I'm dr.ginevra.mills on Instagram.
Awesome. And we will link all of those in the show notes below.
Great. Thank you so much. It was really great to chat with you today.
Yeah, you as well. Thank you so much. Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.